So in regards to pain management after surgery, I do perform a nerve block during the surgery, which simply lasts for the first night. In terms of medications for home, I provide both narcotic and non-narcotic pain medication as well, which should last for at least a week. For swelling, I recommend scrotal support, and I provide that after surgery. But any kind of tight-fitting underwear that raises the scrotum will also help with swelling. A ice pack wrapped in a towel can also help with some swelling and pain as well. And then oftentimes I will leave a drain, which also does help with swelling. So the incision site, of course, should be kept clean after surgery. You can shower. I do recommend against tubs or soaking until the incision is completely healed. So a daily shower is very important. In regards to that, light gauze, if there's any kind of seepage or oozing, that's also fine if you need it, but otherwise it should just be scrotal support, as I mentioned, and keeping it clean. So I see everyone 2 weeks post-operatively, and sometimes if the pump's in great position, I don't recommend pulling it down. If it is starting to high ride a little bit, then at 2 weeks, it usually is not as painful and the swelling has gone down enough where you can start slowly pulling down on the pump and the scrotum. Not everyone needs that, however. So pain meds can be constipating, certainly. We do provide stool softeners to go home with. Utilizing the non-narcotic pain meds as much as possible can help with this, so only take the narcotic pain meds if you do need them. So in regards to restrictions on lifting, bathing, and other movements, bathing, I think it's important to shower, and I recommend that. Soaking in tubs or hot tubs or pools of the ocean, I do not recommend that until at least a month or you get clearance from me and that the incisions are completely healed. This can cause infection. No heavy lifting for 4 to 6 weeks as well, greater than 10 pounds per arm. I don't recommend any strenuous exercise until that time period as well. Vigorous running, weightlifting. A lot of people ask about golf. I do recommend you wait 4 to 6 weeks to golf. So in regards to how soon you can drive or return to work, driving, obviously you have to drive home. Before you drive yourself, I typically wait at least 2 weeks if at all possible, but you should avoid driving only when you absolutely need to after surgery. But 2 weeks is kind of the magic number for being able to drive. And obviously you cannot be taking any narcotic pain meds when you're driving yourself as well. In regards to returning to work, it does depend what you do for work. The first 2 weeks can be painful, so I recommend most people take off the 2 weeks regardless of what they do. If you don't require any heavy lifting in your job, you can typically resume that at about 2 weeks. Any jobs that require full duty or heavy lifting, I recommend you get 4 to 6 weeks or at least clearance from me prior to going back. So in regards to the typical recovery period after surgery, the most painful period is usually the first week or two. In regards to that, the week really 2 to 6 is kind of when we work on inflating, deflating, monitoring the swelling, and then eventually clearing you for sexual intercourse about 4 to 6 weeks after. So what complications should you call me about? Really any complication, but the ones to be really concerned about are any kind of fevers, increasing pain. The pain should always be decreasing. Any kind of drainage, especially if it appears to be bloody of any kind. Any kind of difficult urination, painful urination, burning with urination. If there's really anything you're concerned about at all, feel free to call me. So in regards to your appointments after surgery, we typically make all these for you, but as a general rule, if there's a drain left, we typically take that out either post-operative day 1 or 2. Then I have you come back for a 2-week appointment where I deflate the implant. Then based on the level of swelling, I determine if you're gonna come back for a 4 or 6-week appointment, and I teach you how to cycle the implant during that time period. So everyone is different. I generally tell people 6 weeks till they can use the implant, but some people are able to use it sooner, about 3 to 4 weeks. It depends on the swelling, depends on patient comfort, how they're able to use the implant. So in regards to who you should contact if you have questions during recovery, just call my office. They can always get in contact with me regardless of where I am. I'm happy to answer any questions during your recovery to make sure we get this figured out.